Hi, Jamie Davis from the Nursing Show here at the ANIA 2016 conference in San Francisco. I'm really excited to be here. I'm talking with Amber Thompson from Patient Safe. And Amber, you're one of the vendors here that are really sharing a lot of great information and resources for the attendees. Why don't you tell us a little bit about your background and tell us a little bit about Patient Safe?
Sure. Well, my background has been most recently in the post-acute world, working with patients with chronic illness and really helping patients and their families understand the landscape of, living with chronic illness, the resources that are available, and using technology to help connect those care teams and the patients to create a safe and comforting environment. Oftentimes, we ran into end-of-life issues and a lot of complications on the patient side. So I really have a passion for education and helping clinicians do their jobs, but also connecting with social services and other agencies that are really vital to the psychological parts of chronic illness.
Okay. So what are one of the things that you want every nurse to really think about when it comes to using your types of resources and care of their patients?
So here at Patient Safe today, we're continuously building suites of products that help from the inpatient setting to the outpatient setting. But I'm really excited to be here because we've just come out with a whole clinical solution set that really can be the nurse's tool at bedside, the respiratory therapist tool at bedside, and we really do bedside charting, bedside specimen collection. So patients understand what's happening to them. More importantly, the nurses, can show the patient, here's why I'm using my phone, it's all off of your bring your own device model, but they can be engaged in what's going on. And patients seem to really like that because they feel like you're not looking at your computer on wheels and ignoring me. You're sitting on bed with me and we're doing blood draws and you're talking me through the process. So I think, what I would love to get out to the nursing community is that our mission is to help make your job easier to take care of patients because, my passion for being here is patient outcomes and helping people through that hard part of their journey. And no one wants to be in the hospital and be ill. So the more we can keep the nurses hands-free and keep her, engaging with patients and their families and educating them, that's a win for us. So that's what our tools do.
And I love hearing you talk about engaging the patient in the use of that technology as well, because I think so often patients just think we're doing stuff to them instead of making them a shared member of the care team.
That's right. That was the biggest complaint that I've heard in research over the past 10 years is that patients don't understand the system. They feel as a victim of it, and it happens at a worst time in their life when they become ill. It's not planned events, right? You become ill and you're not expecting it, and it usually brings a lot of other factors into it, and they just feel like they're yet a victim then of the system. Mm-hmm. On top of their health issues, it's a very frightening time for people, and a lot of people don't have coping skills to deal with that. And the nursing community and physician community, they have such a big job to get people well and help them get on to the next phase. But it's very emotional for them because they care about each and every person in front of them as well. The better that we can keep their hands free and keep them using tools and engage patients early in the process, I think it's more likely that patient will follow their care plan once they leave and will use resources in the community that are available.
And it also frees up that nurse and that physician and the other healthcare professional to have more of that one-on-one, face-to-face, eye-to-eye contact time and really help them communicate better. Not only for the patient to understand, but I think also it helps the healthcare person themselves to understand what's being said back to them and maybe pick up on something maybe they wouldn't have picked up on before if they were glued to a screen.
Exactly. And because patients are engaged in that process, as you pointed out, the clinician is less likely to miss something important. There's a lot of things that patients deal with in their lives, and they may pick up on something that sounds like, I need to dig further into that, or maybe I need to bring a consult in because that's giving me a gut feeling that something might be going on that I can help with. And the more there's eye-to-eye contact and conversation, everything's communication, right? Mm-hmm. The more they communicate, the better off we're all going to be because clinicians will understand what that patient's going through.
Excellent. Well, Amber, thanks so much for chatting with me. And where can people find out more information about Patient Safe?
PatientSafe.com. Also, and on our website we have a full set of case studies and information about our team, and all of our numbers are on there, and we're all available to talk to anyone who's interested.
Excellent. Well, thank you so much for chatting.
Thank you.
And I want to thank all of you for checking out this segment here from ANIA 2016 here in San Francisco. I'm Jamie Davis from the Nursing Show. Remember to check out all of our segments available for you over at ania.org and also at nursingshow.com.